Hello, I'm Armida, bilingual speech-language pathologist, owner and founder of New Horizon Therapy. Welcome back to Therapy Thursday, where I answer your questions or talk about a topic as it relates to speech or occupational therapy. I was recently asked, how do you know when to contact a developmental pediatrician? And what is the difference between a developmental pediatrician and your regular pediatrician? So I'll talk a little bit about that. So your pediatrician is, your doctor. That's the first line of defense. That's what I kind of like to think about it. He is the one, or she is the one, the pediatrician is the one that does monthly, the routine checkups, the vaccines, if they have ear infections, if the air's going on, that fever that won't go away, if they're throwing up, just that. Those are the ones you reach to if there's something that is needed immediately. When we talk about developmental pediatricians, those pediatricians are trained to work with kids that show delays in different areas. And sometimes your regular pediatrician, your doctor, another professional, or someone, if you're involved with the early childhood program, they might also refer you to a developmental pediatrician. But developmental pediatricians, and I'll go down the list because I don't want to miss anything, they can basically, the developmental delays can show up in these areas. Cognitive, which is your memory. Social emotional, can they regulate their emotions? Motor, are they crawling? Are they not crawling? Why are they not crawling? Are they not sitting up when they should be sitting up? Speech and language, the way they're speaking or understanding. Disruptive behaviors, are they constantly having tantrums? Is it changing the way the family lives because there's tantrums all the time? Problems with attention and learning, and sometimes that we can't identify until they're in school. Feeding problems, sleeping disorders, complications with toilet training or other bathroom problems. And a big one for me, that eye contact, when you're calling their names, and kids usually have good eye contact, or we can start identifying if they have eye contact at 3 months, because then they can see lights moving or the sound of a voice and any of that. But if that you see, or as a parent or another professional sees any delays in any of these areas, that's when you want to contact a developmental pediatrician, because then they can look at the whole picture, identify if there's a problem and in what area. And sometimes, they can also further refer to a specialist depending on what they find. And I would say, when developmental pediatricians, when we reach out to them, is when you're noticing there are delays in any of the other things that I listed. So part of it is knowing the milestones of kids. The other part, talking to your regular pediatrician and letting them know your concerns and if you should move forward, or finding another professional, talking to them about it. Just someone that knows the development of children, the typical development of children, because as parents, we don't know, but I know there's people we can reach out to. And of course, you can reach out to us, and we'd be more than happy to answer your questions or provide more education, and also provide a list of the developmental pediatricians we have at the office, because we do refer parents when we notice that the children are having difficulties or not developing appropriately, because we cannot diagnose, we can only refer. So, huge topic, but if you have any questions or concerns, or you're just not sure, or any doubts, feel free to reach out to us, and we'd be more than happy to answer your questions and help you out if this is an area that needs to be navigated. So thank you so much for joining me today, and I look forward to seeing you next time. Thank you.